Right, welcome back, movement specialists, to a special episode of Triplane Function, where we're going to talk about distal IT band syndrome, also known as runner's knee. Whether it's you that has that clicking knee on the outside of your knee, whether it's you that has that biceps femoris kind of strain, and you're doing everything you can to foam roll, you're doing everything to strengthen your hammies, and it's just not coming along, this might help you. All right, so this has been a really good success for quite a few of my patients that, they might have had pain after running a mile or two, and they can never just get faster, they can never quite land very efficiently. So, let's load up that IT band and let's see not only how long we can get it, but how well it can react to different stresses of the body. So, Joe, I'm going to have you go ahead and kneel down on your left knee and put your right foot out. So this would be an example of something you can do if you are dealing with a right knee issue. So Joe doesn't have a right knee issue, but it'll be fun to kind of see how well balanced he is, what his motor control is like whenever we get his hamstrings in an authentic position for running, to see if we can eccentrically control that. So let's go ahead and put this foot out. So if you can imagine, this is Joe striding out in a really in a run. Nice long stride. This foot is yet to hit the ground. This foot just did the push-up. He is in that float position. This hamstring is getting maximally lengthened at this point. This is at a point where a lot of people end up getting a torn hamstring, where they might strain their hamstring, where a hurdler might even pull up from a race because of that hamstring injury. Is that because this leg is rapidly coming forward? Absolutely. A lot of people only focus on this from the bottom up, see where the knee is. People don't appreciate really what's happening from the top down. There's a lot of torque that a runner is going through from the top down in multiple planes of motion. So let's identify those. A runner is not as vertical as Joe is. Any good runner, sprinter, is lean forward. So they have a certain degree of forward flexion or anterior pelvic tilt. So already loading into that, Joe's hamstrings start to make him wobble. That's not it. In normal running mechanics, because he's about to land on this side, the body's ready to absorb the shock like a spring, that his pelvis is going to side glide over here towards me a little bit as well. He fell over. What's going on, hamstring? But that's not it. Not only does it have this forward flexion and this right lateral pelvic side glide, this left hand is reaching really far forward too. Like in this right hand is right back here. Joe, where do you feel this?
In my hamstring.
A certain spot?
Yeah, towards my knee.
So is this a flexibility issue? Well, maybe for Joe it is. He's a little bit tight, but obviously there's a control issue. He's wobbling. When you get yourself in this position, are you wobbling? Can you not control this part of your running gait? Because if you can't control this, once you land, Lord help you, something's going to happen. You're not going to absorb shock very well. Is it going to be your foot that's going to pay for it? Is it going to be your knee that's going to pay for it? Is it going to be your hip, your back? Well, like I said, this could happen anywhere in the whole entire body, but this is very specific. What I've been doing a lot for some of my runners that are coming in for this distal IT band syndrome. Simple exercise you can do. Make this lateral part of this hamstring, this IT band, lengthen in all three planes of motion from the top down. So simple exercise is rocking forward and backwards. Give me 5 of those, Joe. 1, 2, 3, 4, 5. After you do that, you can even practice it with a longer stride length. He didn't have very much hip extension on this side, so slide further forward. 5 more like this, Joe. 1, 2. You can tell a little bit more wobble. A little bit decrease of his balance. Do you feel that too, Joe?
Yes, I do.
5. Okay, then not only that, then let's go ahead and get that frontal plane motion. What you have always been doing with your IT band stretches, but have you been doing it from the proprioceptive standpoint, getting this in an authentic position? Move this butt over here to the side. If you need to, Joe, you can bring your hands up over your head and lean over to the left. 1, and come back. 2, 3, 4, 5. If that's a little bit too easy, load yourself in with a little bit more of an adduction motion, so you're running a little bit more narrow, like you're running on a line. Let's do that again. 1, 2, 3, 4, 5, not bad. That wasn't a bad wobble. And last but not least, let's go ahead and I want you to reach as far forward with your left hand and as far back with your right. 1, and then come back. 2, 3. This is for the transverse plane. 4 and 5. And if you're looking for a little bit more of a challenge, then that's where you can even turn this toe inwards a little bit. And same reach, Joe. Do you have that control? 3, 4, 5. If you don't have the control to do it here, do you have the control doing it when it counts, when you're on the road? Try these exercises on your own. Get your body woken up. If you need to, first, take this lateral aspect of this hamstring, stretch it in all 3 planes of motion. Take the lateral aspect of your quad, stretch in 3 plane of motion. Then do this to restore some of the proprioceptive motor control forms so that you can succeed when you run. Thanks, Joe.
Thanks.
Thanks for watching.
See you next time.